I was solo practice for quite a while before I went in with my two partners. And the thing that's been really wonderful in this practice is having all three of the doctors here in the office together. Nobody can be on call all the time. So when I was solo, there's always a possibility the patient might be delivered by somebody they'd never met before. In this practice, our philosophy is that the patients know us and they're comfortable with us. In the obstetrics, they have a chance to meet all of us before they deliver, so there are no surprises. And the philosophy really is we want to be partners with the patients and we want to have their questions answered. I never mind somebody calling me and asking a question because that's what we're here for. I really am very surgically oriented. I wanted to do surgery, but I didn't like surgery much when I was in med school. And then I came to OB and I said, oh, you can do surgery here, but you get to do obstetrics too, which is just a hoot. It's just a joy to deliver babies. And you get to do some medical things with infertility. I guess I like that obstetrics has a lot of range of things you can do. And I also like the fact that for being a specialty, you also have like a primary care, that you follow people along. I have women that have delivered their babies and now they're coming to later life, and I talk about menopause, and it's just nice to know what they're coming from, what they've been through and being a primary care, and yet I'm also a specialist. Whole life management is my special interest. I really enjoy the ongoing relationship that I have with the patients. And yes, I am specialized in doing Da Vinci surgery, the robotic surgery. We're doing more and more complicated robotics. I'm specialized in the obstetrical care. We do hands-on obstetrics. We aren't just midwives, but I really would say my specialty is in my patient relationships, and I enjoy my patients very much. I enjoy what I do. I enjoy the fact that we can change with time and have an ongoing relationship. I'd like them to know that we listen to our patients. I always say to patients the first time I meet them that I never mind questions and phone calls. In fact, we have a thing in this office that if a patient says, I want to talk to the doctor, that chart goes to the desk. I never want a patient to think they can't get in touch with me. I want them to know that I'm available to them. I want them to know that if I don't know the answer, and nobody knows all the answers, I will find them the answer. And I want to be a part of their life and to see it as an experience that is a working together, that we're in this together, and it's all for their continued health. I suppose it's the same as with everything. It's outcomes. When you see that baby delivered and everybody is just thrilled, and realizing what an important part of their life you've been. Even at surgery, when you realize that you've been able to really help another person, that's the most rewarding moment. Even day to day in the office, just knowing that I've touched a life. I always say I do more talking about their social life and how their family is than I do about medical issues, because that's the most rewarding part of the whole job. I often tell people I wouldn't spend a third of my life here in the office if I hated what I was doing in the office. I want it to be fun for me too, and connecting with people is where the fun's at, in no matter what you do.